I will be doing my categorical presentation on Ehlers-Danlos, and I'll be focusing on the hypermobility type. There's over 10 other types, but I'll be focusing on hypermobility. Ehlers-Danlos is a connective tissue disorder, so it affects any form of connective tissue like your skin or your ligaments. Um, Basically, your ligaments are a lot looser than somebody that doesn't have the disorder. It's a genetic disorder, so it's passed down through your family. If your parents or your grandparents have it, there's a good chance that you will also have it. It's caused by a mutation in several genes. They're not currently able to really pinpoint which genes cause which type or even which genes cause just the whole disorder. So therefore, there's no cure, but there are different treatments out there just to help people with the different symptoms. The hypermobility type affects around 1 in 20,000 people. Some of the other types have varying prevalences, but hypermobility is the most common type. Your life expectancy is pretty comparable to somebody that doesn't have the disorder. There's not really anything affecting it. There is, however, vascular type Ehlers-Danlos, and that one really affects your vasculature. So anything with your heart or your brain, you can have aortic rupture or brain aneurysms, organ ruptures. So life expectancy for vascular EDS is considerably lower, unfortunately. But some of the behaviors and symptoms, people with hypermobility EDS experience joint dislocations pretty frequently. Also subluxations, which is just a partial dislocation. So for example, your shoulder will pop out and then just pop right back in. So it's pretty painful, but doesn't require the resetting that a full dislocation does. And then also just general instability, just the feeling that your joints are going to pop out at any point. You can also experience early onset arthritis just from the wear and tear of all of that instability. Because of all of that, sedentary behavior starts to occur just due to the fear of pain or dislocation. So you start avoiding public settings, you start avoiding activities of daily living just for fear of the pain that it might cause, or just if you have a dislocation out in public, now you might need somebody to help you reset it, or you might need to go to the hospital, all that kind of stuff. So depending on the severity of the symptoms, you can become disabled and unable to work, unable to complete activities of daily living, all of that kind of stuff. So interventions in education or activities, it's a lot of physical therapy or occupational therapy, making sure you're moving through the correct range of motion instead of overextending or hyperextending. You want to avoid motions that put your joints at risk. So like overhead stuff, you want to make sure that you're being taught correct movements and all of that kind of stuff. There's also surgical joint replacement, so hip replacements, knee replacements, just to kind of give you a few more years of moving around. A lot of people will also wear braces for unstable joints, so they make finger ring splints that kind of keep all of those joints in place. Knee braces, ankle braces, those are pretty common. Unfortunately, opioids are also prescribed a lot. Just people with Ehlers-Danlos are typically considered chronic pain patients, and unfortunately, opioids are a good pain medication, but I know we have an opioid epidemic in the United States right now, so I think people are trying to move away from prescribing those, even though they do work very well. It becomes a problem with opioid addiction. But one goal related to adapted physical activity is strength training, actually. So if you can strengthen all of the muscles around major joints, your muscles will take up the work that your ligaments are not doing. So exercise, getting the shoulder muscles working, strengthening your quads and hamstrings to stabilize your knee, some light squats just to stabilize the hips, get your glutes working, And a lot of this is focused in physical therapy as well, but strength training really helps getting the muscles to basically do the work of the ligaments. And so, with that being said, it's a little adapted because you have to work around making sure you're not putting them through a range of motion that is going to put them at risk of a dislocation. So, making sure you're teaching proper form, um, but also giving them the confidence to move through these motions. Because now, if they can do, a shoulder press or even just a bench press with some dumbbells, some light dumbbells, now they're able to push a cart like in a supermarket without fear of dislocating their shoulder or something like that. So exercise is really important with people with Ehlers-Danlos, especially strength training. And we're not talking, powerlifting weights, but just some simple strength exercises to work around the problem joints will really help, just with activities of daily living, getting rid of sedentary behavior, even helping with confidence moving around. So it's a really important goal. I used a few resources. I used rarediseases.info.gov, also Ehlersdanlos.com. That's one of the official websites of the disorder. So they have a lot of good resources on there. Also, Genetics Home Reference. That's a website for a lot of genetic disorders, but they do a pretty good job with Ehlers-Danlos. And I myself also deal with Ehlers-Danlos. I have the hypermobility type, so I've gone through quite a lot of physical therapy, and I do a lot of strength training now to make sure that my joints are as healthy as they can be.